Mammography is the most common way for doctors to try and spot breast cancer in women. But the procedure doesn't always work as well as it could, in part because the density of some women's breast tissue. At the Baptist Women's Health Center, they're using a new device that uses ultrasound for additional screening for those women. And as Lurene Cachola tells us, experts believe it can make a big difference.
It turns out it can be more difficult to screen certain types of breast tissue for potential problems. In fact, mammography may miss detecting more than a third of cancers in dense breast tissue. Breast tissue can be considered fatty, dense, or somewhere in between.
So the mixture that you have, if you're mainly fatty, you don't have dense breast tissue. If you mainly have a lot of glandular tissue, then we term that dense breast tissue.
So what? Well, according to Dr. Gayden, it turns out that the density of a woman's breast tissue can make a difference in a couple of ways.
It's kind of a twofold problem. It actually does increase your risk of developing breast cancer, and it also makes it a lot harder to find breast cancer.
It's recommended that women get mammograms, which is the best way to screen for breast tissue that may be cancerous. But the density of the breast tissue that is being screened may actually create problems in seeing potential cancers in the breast.
Well, on mammography, breast cancer can appear many different ways. One of the common ways it can appear is as a lump. And if you have really dense breast tissue, your mammogram is going to look white, and I think we have some images that project that. And it's kind of analogous, people have described it as looking for a snowball in a snowstorm. It can be hidden by all this dense breast tissue that looks very similar to just a lump on a mammogram.
But women didn't always know why knowing about breast density mattered. In 2004, a Connecticut woman named Nancy Capello wasn't told she had dense breast tissue until doctors found advanced cancer that was missed by mammography. She went to lawmakers, and in 2009, her state became the first to require that women be told if they had dense breast tissue and why that mattered.
And that has basically rolled throughout the country. There are now 21 states that do have this legislation. The Breast Cancer Prevention Act started officially in Tennessee January 1st of 2014.
Now, mammogram readings in Tennessee are graded on a 1 to 4 scale to grade density from 1 for fatty to 4 for extremely dense. And a $700,000 grant from the Baptist Memorial Healthcare Foundation is giving women new technology to look for dense breast tissue. ABUS, or automated breast ultrasound, can take a closer look through dense tissue, possibly finding questionable growths that mammograms might miss. But doctors are careful to caution that ABUS is a supplement to mammography, not a replacement.
Screening ultrasound does not replace screening mammography. That remains the gold standard for the diagnosis of breast cancer. And the earliest breast cancers that we find often show up as microcalcifications. And mammography certainly does that better than any other test that we have, including MRI.
The ABUS system is different than standard ultrasound because it looks at breast tissue in sections, making it easier to find masses. The patient lies on their back during the process, which takes about 15 minutes. After the scan, a radiologist then reviews three-dimensional images. Some women may already have information on whether their breast tissue is dense enough for the screening in their records.
Well, you can call 227-PINK, which is 901-227-PINK, which is our scheduling line. And basically, when you schedule your screening mammogram, the scheduler can look at your report from a previous year, determine if you qualify for the exam, and then you would need to have a conversation with your physician to get an order for this exam. It is a screen, and most screens do not require an order, but this one does.
So far, the GE ABUS system is the only automated breast ultrasound approved by the Food and Drug Administration. And according to Turner, the one at the Baptist Women's Health Center is, right now, the only one in the area. For Smart Medicine, I'm Lurene Cachola.